Hello and welcome to Unscripted Leadership. I am your host, Heather Orrico, Vice President of Enterprise Sales and Sales Engineering for Comcast Business. Unscripted Leadership focuses on Comcast Business' role in the tech industry and how it serves its clients. The podcast specifically highlights executives' challenges in their respective industries and how technology is enabling better efficiencies and productivity. You can find us on all your favorite podcast sites, including iTunes, Spotify, and iHeartRadio. For our episode today, I have the privilege of talking to Geoff Brown, Chief Information Officer for Piedmont Healthcare. Welcome, Geoff, to Unscripted Leadership.
Thank you. I'm glad to be here.
Glad that you could join us. So let's just jump right in, Geoff. Kick us off by sharing with the audience a little about your background and journey to becoming CIO of Piedmont Healthcare.
Happy to do so. So I started out, CIOs didn't exist when I started out. I started out in the banking industry, and I was responsible for supporting something called a customer information communication system. Some of you know it as the early days of 24-hour banking. Believe it or not, at that time, you could not get cash out after midnight. They had to shut those systems down and update them overnight so ledgers would show your debits and credits and all that kind of stuff. But what was great about that, the banking and financial industry was known for staying on top of technology. And my skill set was programming, operational support, and communication system support. And so that was what launched me into the business, so to speak. I married early in 1979, and around 81 we had our first son, and my mother-in-law, who was a nurse, came ill with breast cancer. We ended up doing something called a home hospice, and that's where you bring them into your home and allow them to work through their transitions as time goes on. And that happened, but I met visiting nurses. We had a physician around it. I had never been exposed to the healthcare industry per se. So ultimately, a year and a half or two into that, she passed away. And I decided to volunteer for a hospice program, and it was the Emory Grady Hospice Program. And they assigned me patients, and I enjoyed helping families. I was a young husband, so believe it or not, that support structure for me with my mother-in-law, my wife, and helping her through her needs and understanding what this process would look like, it really exposed me to something that really changed my life. And so as I volunteered for hospice, they asked me to support an application I had written. It really was just a real way of structuring my report outs. They would give you 5 or 6 families, and you would be required to take notes and update those notes. And some of that was repetitive, so I put a structured document together so that a group called Key Punch that don't exist today, you could go in and just update forms, give it to them, they would update it, and it would be consistently presented across my reports. And they asked me to do that for the system because you couldn't go out and buy those applications at that point in healthcare. So that was what got me started, and I ended up being recruited by a company called HBOC out at Perimeter area, joined them and became part of their support structure for the hospital, Fulton DeKalb Hospital Authority, and it took off from there.
Yeah. So I love to hear, because we always think about where's the passion come from. And what you just explained to the audience is that you have a passion that's based in, your family environment. Because I think what we're all looking for in our healthcare needs is who understands us, who sees us, who feels us in the moment. So it's amazing for you to share that your passion in this industry comes from a love for technology, but really this holistic care for a person as well.
It's about helping people, and that's the bottom line. And again, you would think that everybody would be conversant with technology, and you would think it would be pretty rampant, but what I found is I had the ability to, develop applications. I had the ability to take ideas that clinicians had or operational business folks had and put it into a program format that would allow them to do some of the early automation that now you can just sort of go and buy from companies that have jumped into the business and and do that. But it was ground up. And so that was my foray into healthcare. And I think I was pretty good at it, and people brought me along and
No doubt.
gave me different roles in it. And my first opportunity was presented by Grady Health System.
That's
as
awesome.
a CIO. Well, actually, the Baptist Health System, Georgia Baptist Health System. And then Grady recruited me in as part of the HBOC consulting group that came in to update their facilities.
That's great. I love this history in Atlanta healthcare and how you've touched so many of the big healthcare systems in Atlanta and helped them grow and develop that technology over time. That's incredible. So you and I have talked about kind of early on, passion, yes, but in terms of leadership, moments of truth is the phrase that you use. And I just have held on tight to that phrase since our conversation. So can you share more with everyone about how your leadership is really founded on moments of truth?
Well, two or three things, but we typically operate behind the scenes. Now, in modern day times, everything is front end and it's automated. You're touching customer relationship management systems and all types of things. But back then, it was, much of the support work and activity happened in the background. And so the only times that it really mattered, on a public front was when something happened or there was a lunch or a go live. And really, it doesn't matter how well you bake the cake. You really couldn't test that out until you went live.
That's right.
So moments of truth for me were, yeah, you're doing it great. You know it in the background. Your team knows it in the background. But it really only counts when it is public facing. When you launch a go live, when there is an issue, in the response to that issue, those types of things. And so that's what I meant by you could be great, but when moment of truth comes, if it doesn't work right, you're trash.
Well, and I love how you set your team on that mission, right? You set your
Right.
team on, we can practice, and you got to practice, right? You have to run the test environments.
That's right.
But let's talk about the real moment of truth, and let's have a plan for how we react no matter how that goes, right?
That's right.
Yeah.
And that's what you're graded on. Is, again, in sports, it's we're here in this facility, it's wins and losses, right? You either hit the mark or you didn't, and that's how you're judged.
Yeah, that's very good. You gave us some inside baseball in the moment. I love it. All right, we're going to pivot to Georgia Hymns. Hymns is something near and dear to your heart. It is something near and dear to the audience's heart. So as the president of Georgia Hymns, tell us what's on your mind, the mind of your peers as you have those conversations with them, and, really just in terms of driving innovation in healthcare.
Well, for me, it's huge because it is an organization that helps you no matter where you are in your career path. If you're an executive level, they have programs to help you develop and mature. There are a couple of organizations. You have HIMSS. There's another organization that's dedicated to CIOs, but I'll stay with HIMSS. And as you go through it, there's a technology arm of it. There is a organizational arm of it. There's an arm of it that allows you to develop and mix with your peer groups and talk about things that are relevant to your organization, but also understand what's happening in other states and in other market areas. And so as you look at it, what I found out anyway is it doesn't matter what somebody else is doing. What really, again, matters is what your organization needs and your ability to, I would say, collaborate with the business leaders and sort of convert and translate information in a way that they can receive it through governance. For the most part, you're able to get everyone aligned on what the investment stream needs to be in order to accomplish or move from A to B with whatever the solution is. And as you start to look at leveraging and standardizing and those types of things, it's really a journey. Because again, remember, there are many different parts to the ecosystem on a technology level, and people don't really want to get into the technology. They really want to understand how you're going to address or solve a business need, or from a strategic perspective, how will this allow us to accomplish communication within a certain market, or maybe we want to address a group of patients or providers in some way, or maybe we want to make enhancements to the way they do their jobs so that they can effectively do those in a very coordinated way. And so you have to convert technology into a business communication that people can understand, and and that's how you you're successful.
I keep hearing this theme of you being the master at blending technology and people, meaning that you're bringing the business leaders, people to the table to say, hey, what are you hearing from the people, the clients that, traverse our doors every day in our system every day? What does that look like? So I think you're getting it right. And it's just something that a lot of people struggle with, is finding the time to have those conversations and then implementing meaningful results.
I would tell you there's a whole back office operation. So, the secret in the room is the front end things are the things that touch your employees that support different departments and users. But behind the scene, you have folks that work on your network. A network is how you connect environments and use smart technology like your phone to exchange or email. Those types of things happen on a high volume level. You have folks that look at the infrastructure and data centers, and a ton of people to keep these things and keep the lights running, and so to speak. And they do a number of things behind the scene that no one is aware of. But if they don't do those things well, it creates problems in the environment. And so, again, very important group. And there's a whole industry of folks that do that. And that's really the back end side is really much of what IT is all about. The high profile applications that you use, whether it's email or whether it's EHR systems. EHR systems are where patients get registered, they get scheduled for labs or imaging type technology, and that's all sort of consolidated into a framework. That's all that you see on the front end, but behind that there's a whole series of professionals that make it happen. And so you have to take that and then communicate in ways that support, so they get the information they need to be effective. But also you have to talk in terms of what your business needs are, so that the organization can make good decisions around it and informed decisions around how do we come together strategically.
Yeah, and what's that forward-facing impact? So we're doing all the minutia, all the behind the scenes, but how does it land for the moment of truth when you're launched, right?
Everything is a moment of truth, I believe, at some level.
That's right. Again, that will stick with me, I believe, forever. So we talked a little bit about HIMSS. Thanks for sharing more about your presence there, your commitment there. Talk to me, too, because that's a time commitment. So what other charity or community investment is a passion project for you?
I do a number of things outside of my formal role, but again, I'm committed to, as I've seen families and seniors, I like to support programs like during the holidays, that type of thing that we recognize and participate in.
That's great.
Helping others get dinners and things like that. So, nothing major, but it's always community-based. And so I like to do community-based types of things. But I would say, my family in particular enjoys connecting with the communities that we live in and making sure that we're part of those efforts.
That is awesome. Yep. This impact, sense of community, it's really your DNA, right?
I think so.
Yeah, it is. It's just the way you live your life. I love it. And started out that way, as you shared. So tell us then what technology trends, Geoff, are you most excited to explore in the next 5 years or more?
Well, there's something hot right now. Everybody heard of this new term called ChatGPT, or
That's
generative
right.
AI, artificial intelligence, and I think that's a driver even in our environment. Just about everybody now that you hear from, there's something about AI. You're hearing about the impact it can have on the workforce and some of the things, some of the tasks that it's capable of doing to allow people to operate at a higher level of their licenses, or maybe some mundane task that you can prescribe for it to do, and then allow others to then have a group of things that they would having to do independently. Maybe now you can scrub it, get a group, and then if it meets certain criteria, it can just go through and process. And then that person deals with those things where there was some sort of condition or error or another piece of information that was missing, and you make folks a lot more productive in that sense.
That's right.
And so I consider AI at Piedmont, we call it intelligent automation. Okay. And it really represents a series of systems, whether they're robotic process automation tools or whether they're strictly AI developed applications that you do in-house, whether there are a series of things with the vendor community that you work with or the products that you license and sort of leverage what they're doing in a way that is cohesive with whatever your strategy or the needs are in your organization. And so we're looking at a family of different automated machine learning products, if you will, that will sort of form our population of applications at Piedmont. And we're all trying to grasp with what is the right way to do that, how do you govern, what are the right projects to take on, and then, of course, how do you put metrics in place to ensure that you're, in fact, capturing and making a difference.
That's right.
In the organization around whatever the deliverable items are. And so that is something we're working in right now. I think we're also coming out, while everybody's trying to get away from it, we're coming out of the pandemic. And in our particular case, I think we have grown significantly in Georgia. So one of the things we want to do, and I sort of compare it to this, when you grow businesses, you do those fairly rapidly. It's like having your house. Let's say if you or your first apartment, no kids, anything like that. Then you have kids, and they fill up the bedrooms. But then maybe your parents move in, and now you may have to add on another room or two. Well, they have cars, you have cars. Maybe you decide you want to put in a shed over here, and a garage over there. Well, one of the things we're doing is always making sure on the core level that we are trying to be consistent from a standards perspective. And that really means now you get everybody in, we're all on the same boat, but now you need to redesign to ensure that you're doing things in a proficient way and that you standardize the work so that anybody can move from one place to another and have consistency with how certain work is done, how certain treatment of patients is handled, how we work with our provider community in ways that allow them to have good integrated communications with the staff, with the patients and families, and with the vendor communities that we have to interact with the communication teams.
That's right.
And so forth. So again, very important work, and it's iterative. So you have to do it in a way to where there's good collaboration and so it's just a constant act to bring these things together, and it takes a team of folks. So you might think of it as a technical responsibility, and there's the part that's technical, and I grew up in that arena, so I have that skill. But I think the other part of it is collaborating with people that have no interest, have no idea about technology, but they do have great strengths around the business and how to accomplish strategic goals that are important for the organization. So we have to marry the two, and so I think that's become a big part of it now. Back at one time, it was back office
That's
work.
right.
Now it's front office. It's straight. It's part of innovation that happens in a company, as well as just pure day-to-day foundational operations.
Yeah, that's right. And it's interesting because you are zoomed into this. We talk about the managed services stack, we talk about security stack, and it's very easy, particularly when time is limited, to say, okay, let's put this Band-Aid over here. And what you're talking about is, no, we have to be strategic. We have to make sure that that's seamless, and we have to understand the impact across all departments.
That's right.
In the collaboration piece. So it's good that you see it like that and execute on it in that way, right? I want to take you back, if I can, for a minute to AI. I think it's exciting for our community to hear that you're on the cutting edge of how does this work in the healthcare industry and at Piedmont. You said something that was interesting, which was impact to productivity of people. What is the culture impact? What are you early on seeing as a culture impact to people at Piedmont?
Well, I wouldn't say we have it all figured out yet. I mean, it's so new, particularly some of the more recent tools that have been made available. But AI has been involved in healthcare for a long time. So you might think about images. We have a number of imaging applications. A couple of them really take advantage of AI technology, where it looks at patterns and it can sort of pull together certain groups of findings together so that results can be reviewed quickly by clinicians. It can identify maybe some things that might be troubling. It won't make a decision, but it may present information in a way that someone trained can review it and say, okay, well that is interesting, and take action on it. It helps in ways where you're collecting certain data points after a patient leaves, and there's work that you have to do to get it put together in a quality way so that it can be reviewed and passed on to others. And so you're able to take that technology and automate and save minutes, hours, in some cases days of work over a period of a week that somebody physically, manually had to perform. And so that's drilled into a number of applications. In fact, we recently reviewed ours, and even prior to the Chat GPT wave, we found that we had probably 12, 15 applications that were leveraging AI in some form or another that would really driving great results.
That's
Our quality safety service teams have been taking advantage of what we call RPA, or robotic process automation technology, for a few years now. For instance, one example would be they would have to go to a website, compare the result within that website, fetch something from 3 other websites, and if it all matched, they still had to do it with every single case. Now, probably 70% of that is automated, right?
Wow.
And all they have to now do is do the 30%, and it allows them to do other quality control processes in that space. So it's not always about displacing people, and
That's
the way
right.
it's sort of put in the media, but it also prevents you and slows down the path of how you grow, and it keeps people happy because they're working at the top of their licensing or their skill set, and they're doing that more important work and mundane work you're trying to eliminate or reduce and automate. So again, that's the way people really should look at it. But the push is it will take away jobs, and in most cases it doesn't take away jobs. It enhances the ability to get things done, and in fact, it moves you from having folks doing mundane tasks to more meaningful tasks. So I think people are happier with that as well.
That's right. And we all know that happy employees and great employee experience equals great customer service.
That's
right?
Yes.
So I love your take on it. Thanks for sharing. Talk to us one last thing. What does Piedmont Healthcare think of Comcast Business? We have this great partnership for multiple years. So what makes that partnership unique comparative to others?
Well, one thing I like about it, I had an opportunity, I won't call names, but being in my role, I'm out in the community quite a bit, and I work with my peer groups across the state, and I've been active in some of the organizations that we talked about earlier. And the reality is, there's a delicate balance between your teams and the work you do in your company, but you also can't do your work and you can't make progress without your partners and vendor community. And one of the things that I noticed as we were starting to grow, we needed to diversify our strategy around how we connect different entities in, and we needed to just bring a little more complexity to that. And I had the opportunity to watch one of your, I would say, marketing people get involved with another organization. Obviously, they wanted to, they're there to bring home your business, Comcast's business, but was just very professional in the way that she operated. And I'm used to aggressive, assertive folks just hammering you to try to get in. But the quality of that led, and it didn't happen overnight. As we started looking at diversifying our network strategy and having backup circuits and a variety of things, I learned more about the investment and infrastructure that had been done by Comcast. And so, it met a need, and I didn't have to seek her out. I knew where to find her, introduced her to our teams, because the way it works, I rarely dictate a relationship. I think it has to evolve, and we have to make sure that it's the right fit, right cost, right structure for Piedmont. And it just played out. But the professionalism, the commitment to the work being done in the community, being part of some of these movement groups to help develop young people. For instance, in Georgia Hymns, we give out 6 or 7 scholarships a year, typically coming from the schools. This year we had representatives that won scholarships that attended Georgia Tech, Georgia State, Kennesaw State, a number of other institutions, and those are the future leaders. And at some point in the past, a lot of us more senior people relied on that ecosystem to grow, develop, and so those things get me excited. But that's one thing that I liked about the Comcast organization. I didn't know you when I came. So prior to joining Piedmont, I was in Virginia, Northern Virginia, at a health system there. And when I joined, I didn't know any of the reps here. I knew of Comcast up there, but didn't know any of the reps here. But it was just through observing the way your organization was connecting into those organizations, but knowing how to do it ethically and do things the right way. And that just made an impression on me. And when the opportunity presented, I certainly connected Comcast up with the right folks on my team, and we started a dialogue. And behold, we started with something small. Now you guys have some part of the ecosystem around our circuit strategy.
That's great. So it started with this catalyst of an amazing person, and I know who you're talking about. We love her dearly. This catalyst of this amazing person, but the truth is, I said DNA earlier, and it's what does a real partnership in terms of company relationships look like? And it's this additional commitment, not just the network, not just the infrastructure, but the commitment in the community. How are we all dialed into community impact, et cetera, and things like Georgia Hymns together? So thank you for rounding that out for us, because it's passion projects for us too at Comcast, not just about infrastructure. So I appreciate it.
It still is always about competitiveness, right?
True.
If you're not able to offer the services in a competitive way, even though I might like the person,
right?
If you're not competitive in how you're going about pricing your offerings out and being very versatile in how you can incorporate that into your environment, we can't use you. So
That's
I
right.
would say there's a level of proficiency in it, and there's a level of competitiveness in getting the business. So all of those things come together. And then, of course, if we're going to be relying on you to support our business, you have to have all the performance metrics and all the other stuff that goes into it. So
That's
it really
right.
is a lot more complete, more of a total process than just sort of saying, "Oh boy, you're a nice person," right?
That's right. That's right.
So just
it can start with a handshake, but it ends with an ecosystem,
That's
right?
That's exactly right.
I thank you for putting a bow on that. I love the way you put a bow on that, because it is our goal to stay competitive. And it's, to your point, it's a necessity. So, Geoff, we greatly appreciate your insight today, and it's truly been a pleasure for myself and the audience to get to know you more. Thank you for being a Comcast Business customer and partner. We value you so much. And for our listeners out there, Comcast Business offers Ethernet, Internet, Wi-Fi, mobile, voice solutions, TV, of course, and managed enterprise solutions, as we talked about today, to help organizations of all sizes transform their business. So talk to us today to find out how we can help your business grow and thrive. And you can find the Unscripted Leadership podcast published monthly. So we hope you will continue to tune in with us next month and beyond. Thanks for joining us today.